Narcolepsy. Narcolepsy is a neurological disorder that affects the brain's ability to regulate sleep-wake cycles. People with narcolepsy experience excessive daytime sleepiness, which can cause them to fall asleep suddenly and uncontrollably, even during activities such as driving or working. Narcolepsy is a chronic condition that can be managed with medication and lifestyle changes, but there is currently no cure. Narcolepsy symptoms. The symptoms of narcolepsy can vary from person to person, but the most common symptoms include excessive daytime sleepiness. People with narcolepsy may experience extreme drowsiness throughout the day, even after getting enough sleep at night. Cataplexy. A sudden loss of muscle tone triggered by strong emotions such as laughter, excitement, or anger. Sleep paralysis. The inability to move or speak for a few seconds or minutes while falling asleep or waking up. Hypnagogic hallucinations. Vivid, dream-like experiences that occur while falling asleep or waking up. Fragmented sleep. People with narcolepsy often have trouble sleeping through the night, waking up frequently or having trouble falling asleep. Other symptoms may include automatic behavior, performing routine tasks without being fully awake, snoring, and restless sleep. Not everyone with narcolepsy will experience all of these symptoms, and the severity of the symptoms can vary. Narcolepsy causes and risk factors. The exact cause of narcolepsy is not fully understood, but it is believed to be caused by a combination of genetic and environmental factors. Here are some possible causes and risk factors. Genetics. Narcolepsy can run in families, and certain genes have been associated with an increased risk of developing the disorder. Autoimmune disorder. In some cases, narcolepsy is believed to be an autoimmune disorder, in which the body's immune system attacks healthy cells in the brain that regulate sleep. Brain chemistry. Narcolepsy may be caused by an imbalance of chemicals in the brain that control sleep and wakefulness, including hypocretin, a neurotransmitter that regulates sleep and wakefulness. Brain injury. Trauma to the brain can sometimes cause narcolepsy or similar symptoms. Infections. Some infections, such as streptococcal infections or H1N1 influenza, have been linked to an increased risk of developing narcolepsy. Age and gender. Narcolepsy can occur at any age, but it most commonly begins in adolescence or early adulthood. It also appears to be slightly more common in males than in females. Having one or more of these risk factors does not necessarily mean that a person will develop narcolepsy, and many people with narcolepsy have no known risk factors. Related conditions and behaviors. There are a number of conditions and behaviors that can be related to narcolepsy, either as potential symptoms or as complications of the disorder. Some related conditions and behaviors include obesity, depression and anxiety, insomnia, sleep apnea, restless leg syndrome, substance abuse, and reduced productivity. Narcolepsy can interfere with work, school, and other activities, leading to reduced productivity and difficulty maintaining relationships. Narcolepsy diagnosis. Narcolepsy can be difficult to diagnose because many of its symptoms are common to other sleep disorders. Here are some steps that may be taken in the diagnosis process. Medical history. A doctor will ask about a patient's symptoms and medical history, including any family history of narcolepsy or other sleep disorders. Sleep diary. Keeping a sleep diary can help track sleeping patterns and provide insight into the severity of daytime sleepiness. Sleep study. A polysomnogram can be performed to measure brain waves, muscle activity, and other physiological factors during sleep. This test can help diagnose sleep disorders such as sleep apnea and restless leg syndrome, which may be present alongside narcolepsy. Multiple sleep latency test. This test measures the time it takes a person to fall asleep during the day and can be used to diagnose narcolepsy. During the MSLT, a patient takes a series of naps, and the time it takes to fall asleep and the presence of REM sleep during these naps are measured. Blood tests. In some cases, blood tests may be used to measure the levels of hypocretin, a neurotransmitter that is often low in people with narcolepsy. Diagnosis of narcolepsy can be a complex process, and patients may be referred to a sleep specialist for further evaluation. Narcolepsy treatment. There is no cure for narcolepsy, but there are treatments available to help manage its symptoms. Treatment may include a combination of medications and lifestyle changes, such as stimulants. Medications such as modafinil, armodafinil, and methylphenidate can help reduce excessive daytime sleepiness and improve alertness. Antidepressants. Certain antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, can be used to manage symptoms of cataplexy and improve nighttime sleep. Sodium oxybate. This medication can help improve nighttime sleep and reduce daytime sleepiness, as well as reduce the frequency of cataplexy episodes. Scheduled naps. Regularly scheduled naps throughout the day can help reduce excessive daytime sleepiness. Avoiding triggers. Avoiding activities or situations that trigger symptoms, such as alcohol consumption or intense emotions, can help manage symptoms. Sleep hygiene. Developing good sleep habits, such as maintaining a consistent sleep schedule and creating a relaxing sleep environment, can help improve nighttime sleep and reduce symptoms. Work closely with your doctor to determine the best course of treatment for narcolepsy, as treatment may need to be adjusted over time based on individual symptoms and response to medications.